Asthma is one of the most common long-term conditions in children, but it's also one of the most poorly managed. Aside from confirming the diagnosis, prescribing and giving the correct treatment, another common reason for poor asthma control is exposure to triggers, which are everyday things that can make your child's asthma symptoms worse. And understanding what triggers your child's asthma is a vital step towards helping them live a healthier and more active life. So what is a trigger? A trigger can be anything that worsens asthma symptoms or causes an asthma attack. Triggers don't cause asthma itself, but they set off the inflammation and tightness in the airways that lead to coughing, wheezing, shortness of breath, and chest tightness. Every child is different, so some may react strongly to one or two triggers, whilst others may be sensitive to many. What are some of the most common asthma triggers? Well, some of the things that we see most commonly in practice in children with asthma include viral infections. So your cough and flu viruses are the most frequent causes for asthma attacks in children. Even a simple cold can lead to wheezing or breathlessness in children with sensitive airways. And this is why many children with asthma have worse symptoms in winter and during cold and flu season. Allergens, of course, so things like house dust mites, which are microscopic insects found in bedding, carpets and upholstery, pollen, especially during spring and summer hay fever seasons, pets like cats and dogs are common triggers, and mold spores, so particularly in damp or poorly ventilated homes, can make asthma worse. And children with both asthma and allergic rhinitis are often more likely to react to these triggers. Cold air in the winter, so breathing in cold or dry air, especially during exercise or early mornings, can cause your airways to narrow. And this is why many children experience worse symptoms in colder months or with exercise outdoors. And exercise itself can trigger symptoms, especially if asthma is not well controlled. This doesn't mean, of course, that children should avoid sport. In fact, with good asthma management, we hope and expect that they should be active and participate fully in sports. Smoke and pollution. Exposure to cigarette smoke, wood smoke or air pollution is a major trigger. Even passive smoking from parents' clothing can affect a child's airways. And so does living in urban or high traffic areas put children at much higher risk for asthma attacks. Strong smells like irritants to perfumes, air fresheners, cleaning products, paint fumes and aerosols can all irritate the airways, and minimizing these in the home can be helpful. Emotional stress or laughter, things like intense emotions like excitement, crying or laughter can trigger asthma symptoms in some children, as can anxiety and stress. And if these are present, then psychology or counselling supports may be useful. How can parents help? You don't need to eliminate every possible trigger. That would be impossible. But you can observe and record when your child's symptoms appear to help identify your child's individual triggers. You can then create an individualised asthma action plan alongside your doctor and asthma nurse. And of course, you should always try to avoid or minimise exposure to known triggers where possible, such as using hypoallergenic bedding, stopping smoking, vacuuming regularly, and keeping pets out of bedrooms. You should ensure your child takes their preventer inhaler as prescribed, and this will help reduce airway sensitivity over time. And stay up to date with vaccinations, including routine, boosters, and flu vaccines when eligible. When should you seek help? So you should seek medical advice if your child's asthma symptoms are worsening, if they're needing their reliever or blue inhaler more than 2 times per week, they're waking at night due to coughing or wheezing, their asthma is affecting their ability to exercise or attend school, or you're simply unsure what's causing your child's asthma attacks and flare-ups. Because early review and management can reduce the risk of further asthma attacks, and severe attacks needing hospitalisation, and help your child to live confidently with asthma.